So for the viewers, what is type 1? What are the differences? What does that mean to them?
Totally. So whenever I tell people that I have diabetes, people immediately are like, oh, I know someone with diabetes. And typically most people do. But diabetes has been classified to two types, type 1 and type 2. Um,
Correct.
I was going to say typically type 1 is known as juvenile diabetes, and type 2, I'm not sure what it's called as.
More referred to as like onset. Usually population of more, maybe not overweight, but more of the, poor diet, poor exercise, poor training, and it just kind of develops.
Totally. To be honest, that's why we have him here. My limited knowledge of type 2 is going to be sufficed with you. But for type 1, actually, I was reading that, funny enough, it's either 5 to 13% of people who have diabetes right now have type 1 in the United States. And even though it's called juvenile diabetes or referred to it as that unofficially, it's been found that you can actually be diagnosed in it later on into even adulthood.
I recently found that out. I had going through school. That was our whole thing. Was it was either it was juvenile diabetes, and it was usually before the ages of, I think 12, 13 was what they were telling us, and it was usually, all right, they got it, and if it comes on later, it's going to be type 2. What are the differences?
Totally. So the way, I guess one way to differentiate between the two is for type 1, the pancreas, basically the autoimmune, the insulin producing cells in your pancreas, basically, your immune system basically starts to fight to kill them off and can't differentiate between which ones are like insulin producing cells, like the good ones, and the bad ones, so it just decimates them all. Am I wrong? Something about beta cells.
Yes, your beta cells and the pancreas can't differentiate. That's the difference between insulin resistant and insulin dependent, I believe. Type 1 is generally they just don't make insulin, and type 2 is generally you've grown a resistance to it and it's just not absorbed well enough into your body, I guess. It's just you just develop a resistance to it, and so you don't accept it as much as you should. What does insulins do?
Oh, insulin is basically, the way that it was kind of like an analogy was like it works to break down glucose that's in your body to turn it into energy. So you do need it. Otherwise, there's sugar accumulating in your bloodstream. Am I wrong?
Correct. Needs to get filtered out. Needs to get accepted.
Yeah, and love that you're here, because I'm clearly trying to like recall to all those diabetes education. I've clearly not held on to all the key important parts, but the key and lock mechanism that works with it, it turns it into usable energy. But if you are not able to get insulin, you can actually your blood starts to turn acidic.
So you get hyperglycemic.
Yeah.
And so you turn in, there's a bunch of other things you can go into, anything from, hyperglycemic is tend to be, dry mouth, really thirsty.
Fruity breath sometimes.
Fruity breath, hyperketoacidosis even onset, which is like, we don't need to go deeper into that.
Oh, no. But it's super bad in the short term sometimes. So like feeling like
correct.
Or like feel super fatigued. This unquenchable thirst. I was actually telling you earlier about Kendall Simmons, who used to play for the Steelers. He was actually diagnosed later on when he was going to his rookie training.
Right, so he's one of the late onset type 1s.
Yeah.
So complete rejection of insulin, basically.
Absolutely, and even the doctors at that point were also kind of hesitant to even diagnose him as type 1, because how often do you see like a 20-year-old, 21-year-old coming into your emergency room saying like with high blood sugar?
Right. And you were saying that there were stories of him like before training camp in the car just trying to down Gatorades, which was not good if your insulin resistant.
Totally.
By the way,
unquenchable thirst. I feel like it's like as if you walk through a desert and no water in sight. That's how it feels. Like no bottle of water can quench it. On the other hand, so I use insulin to basically, after I eat, I administer insulin through subcutaneously, just basically through into the fat cells, whether it be through an insulin injection, but I actually wear an insulin pump, which I'll talk about later, and that is how I regulate whatever I eat. What's cool about type 1 diabetes is that it was never caused by any lifestyle or dietary habits. It was just happened. And the way that, I guess, what I was told, that way to think of how type 2, on the other hand, which is a majority of the population, is like your pancreas was actually injured, whether that be from an unhealthy lifestyle or
correct.
So
that's how people usually tell what's going on, if someone's getting a lot of hyperglycemia, or if you're getting hypoglycemic. Usually it's hyperglycemia because insulin helps get the sugar out of your bloodstream. So if you're getting these, I'm always thirsty, I'm always tired, blah blah blah, like
frequent urination.
Yes, polyuria, polydipsia, and I read the other one, but polyuria, polydipsia is excessive drinking and excessive urination, because you're trying to filter it out, but the insulin can't take the glucose out.
Exactly.
And so if you're seeing someone who's like relatively fit, thin, and they're coming in with that all the time, that's when they generally are like, well, you're going to have type 1.
I dropped, even though I was only 9 years old, like I dropped 8 pounds, and I wasn't, 8 pounds is a lot at that size. So
absolutely.
My moms always know when something's off with you. Dad said I was fine. Dad was convinced that I was totally okay and that my mom was
Rub some dirt on it.
Exactly. It's like, just let her drink some water. She'll be good. But shout out to Mom for taking me to Oakland Children's Hospital. Right? Shout out to them. Now UCSF.
Resident. I've been to Oakland Children's. Let's go.
Loved the hospital. I think at first it was really hard to be diagnosed at that age, especially you don't know what it means.
As a kid too, like, you're different. It's never really, not like it's not good to be different, but it's always like a change to know that you're different at such a young age.
Totally. And it's like you feel like you're going to be treated differently, whether it's from your peers, whether it's from your parents, right? Like, or the thought of like, oh, well, parents want me to come over to my friend's house for a sleepover because now I feel like a liability, right? Like, that's a thought that's going.
They don't have to monitor my glucose or give me whatever.
Exactly.
So were you giving yourself insulin shots, or how did that work as a child? Like, what was the...
Totally. So at the time, I guess, back way then, when you have to do the finger pricks, so I was totally cool doing the finger pricks for...
Right, to check it.
Yeah, for the first 2 years, I just would not feel comfortable with giving myself an injection. Like, I was already one of those kids. Like, they had to hold me down to give me an IV, just to give you an idea of how fearful I was of needles. But after 2 years, I warmed up and I was able to give myself the shots. So, but those first 2 years, I did have to have my mom come wherever I was going. Could not go many places without, like, my parents at that point.
Right. You were worried if something were to happen.
Totally.
Blah, blah.
Totally. I guess we mentioned hyperglycemia. Just to give you the other hand, I guess hypoglycemia. Right. One way that I try to, like, explain it to people is, like, you've seen Paul Blart, the mall cop, when he's, like, basically getting candy off the floor. It's like, you need sugar to raise your blood sugar back up. Sometimes you might miscalculate and give a little more insulin than you intended to. And my favorite thing is juice. Yeah,
orange juice. Orange juice, apple juice. They should always have that on hand. Any medical clinic you go to, they should have some sort of juice, cranberry juice. So if you do, for whatever reason, are new to the diabetes gang or whatever, they should have that very, very consistently wherever you go.
You just mentioned diabetes gang. I was going to say the funny word that, like, within the diabetes community, whenever you see another diabetic person or someone who's...
what did I say?
No, whoever.
Okay.
It's a good thing. You're about to be initiated.
Let's go.
Whenever you see someone else who has diabetes or knows about type 1 diabetes, you become diabuddies.
Oh.
Yeah, so you can become my diabuddy today.
Diabuddy.
Yeah.
I have found the I guess the community is the right word. The diabetic community is very open with talking about it because it has become with the age of the internet and all this, and obviously even what we're doing here,
Totally, right now.
everything's so there's so much information readily available, and you can connect with so many like-minded people and like-willed or like troubled people in that way, or
Absolutely.
like whatever situation you happen to be in, you can find someone in a similar one somewhere, some way, somehow. That I found a lot of people that I met with that are always like really pretty interlocked with that community, and there's a lot of things like we were talking earlier, kind of off camera, about like summer camps and things like that, and going into that. Was that like at a young age? Was that something you were down with, or did you have to kind of be like coaxed by like your parents or other people, like you should be having friends like this, or were you like, I want to go make diabetes now?
Oh, funny. That's a really interesting question because I resented having diabetes for the longest, and I think that almost continued even through high school. But
do you think that was an age thing? Do you think that's because you were young and kind of wanted to be with like your friends or stuff, or was that a kind of like I disliked what I had to do because of this?
I think it was I'm a mix of both, but I definitely wanted to fit in, and you don't fit in when you get to eat snacks in class and no one else can have food out, right? Like that, you sticking out like a sore thumb. Like I got to keep a little juicy juice and what's it called? Some saltines in the classroom, even in grade school. So like everyone's like, oh, we get special treatment.
Right.
But and because of that, I started to hide my diabetes and became what's the word? Not the best diabetic. But after my
Diaworstic.
Diaworstic, that's a new one. I'll ask the community about that one. Get back to you.
Please don't. I don't want to be
Dr. T, making fun of diabetics, you guys. I'm just kidding. But I was gonna say that my endocrinologist, which is a diabetic doctor, he's the one who was like, you know what, like it doesn't seem like you're doing that great with your diabetes management. And this was, I think, when I was 16,
right.
And he suggested I go. He's like, it's super fun, like you'll have a great time. Went, and after seeing other people with similar, just with doing the same thing as I was doing, it normalized it, and I was able to feel comfortable. So like I came back super excited to tell everyone about all the fun I had at diabetes camp.
Right.
But yeah, but after that, I think that was like the turning point for like when I'm able to actually like talk about my diabetes. And I didn't feel so ashamed anymore because I saw like, oh, it's actually super normal. I saw 100 other kids at camp.
I was about to say, how many people were there?
So at this one there was, I think, I don't want to be wrong, but maybe 200 to even 300 kids.
Are they like all from like East Bay? We talking California? We talking Arizona? Like how far did this branch out?
So this one that I went to, most people are actually from California, but when I started becoming a counselor there later on after I turned 18.
Oh, that's cool.
Right? I just loved it so much I wanted to go back. Like being a counselor was the closest thing I could go back to going to camp.
Right.
But outside of that, like I noticed even I have a family friend who flew in all the way from Virginia to come to it. She's also diabetic.
Oh.
Yeah, and she was diagnosed with it later in her teenage years. She was 17 when she came, and I think she stayed in contact with some of the girls that she met there too. So.
I was just about to say, is that like a thing? I feel like that would be a kind of cool thing. Like, this is my friend I met at diabetic camp.
Yeah.
Like, that would be kind of cool. Or like a very intimate. I feel like friends like that you are friends with so long, as long as you pass like a certain threshold, you were just at that threshold of friendship forever. Mm-hmm. And so, do you still keep in contact with?
You know, funny enough, absolutely. That's probably the only reason why I still have my Facebook page open.
Okay, I was about to say this. I'm gonna feel really bad if she doesn't. I'm just gonna be like, wow, this would be such a cool thing. And
right? No, definitely. Shout out to Facebook.
Okay, good.
For keeping those connections, right? But
absolutely.
But being a counselor there at least gives me that like opportunity to do the same thing that someone else did for me. But yeah.
Right, that's cool, and it's nice to be able to know that there is a difference. It's not like different, like everyone has something wrong, so it's nice to know it's more open to like world knowledge now. A lot more people know about it, maybe not to the extent of like insulin, beta cells, like glucose acceptance, about hyperglycemia and hypo, but you know, like there's something with their blood sugar, and sometimes they need to eat, sometimes they gotta, you know, take a drink of some orange juice or have a cracker or whatever to get some things down, you know.
Totally.
And so I think that's cool now that I recently have found out about that whole community, and I was like, oh wow, this is so cool, because we learn about it all in school.
Yep.
And they teach us, all right, here's the telltale signs of a type 2 diabetic. If they have this, they're going to have potential like sensory neuropathies, and they're going to have like they're going to lose feeling in their hands and feet, and it's called the glove and stocking neuropathy. So they'll kind of like lose feelings up the hands a little bit, like little tingling sensations, or they have just less feeling in things. So they have like pressure ulcers, and so we get this, I don't know, like a cookie cutter notion of what like a diabetic is, even in school. So I come out and I'm like, I mean, I kind of know what they are, but like, I know what we're not supposed to do, and I know like the precautions for it, and what we're supposed to do. Like, oh yeah, always have orange, blah blah blah. But it's nice to be able to talk to people. It's like very different, and you don't have to be I don't have to be like a hawk, because everyone's so knowledgeable about their own stuff now that I don't have to sit there and kind of, did you take your stuff? They'll usually tell me. I actually had a patient that I would work with that he had a hip monitor like that, and he would come in and be like, well, I'll be right back, gotta go to the bathroom real quick. And so we'd go, and he'd like, I don't know, get a snack or whatever you do, and he'd come back and be like, all right, we're good. You check in. I was like, anything I need to? I'm like, you're gonna know this better than I do at this point. And so I was like, oh, that's cool. But that was always a cool thing. So I really, really enjoyed him as a patient too, opening me up. He also talked about that of, maybe he didn't go to Diabetic. I don't know if he went to a camp, but he was like, yeah, the community's really strong. And I think as an adult, I just felt like they had like things like that, but I didn't realize for the kids they had
day activity too.
Yeah.
Like, they had like daytime stuff.
Go hang out. Yeah. Just have orange juice everywhere. I like that.
Orange juice, insulin on the cooler.
No, that's gold. Yeah, that's good.
It's cool to like normalize it, right? And I feel like I wish that I only became such a decent diabetic. I'm not gonna say good diabetic, because everyone has bad days.
Enough.
Became a good enough diabetic because I'm comfortable for advocating for myself.
Right.
You know? So it's like, it's cool that you can just dip out to the bathroom in the middle of your session, right?
Yeah.
To go take care of it.
And that also, he was comfortable enough to be like, I'm diabetic, like blood sugar. I've been able to get my blood sugar regulated all day. He'll come in and be like, it's been like my blood sugar, glucose has been up and down. Like today, it's gonna be a roller coaster. I don't know if I can do a bunch today, and I'll be like, that's fine. Like, as long as you're aware of that, and like we can know those things. So it's really cool that how much they can kind of just understand. And you guys are already very aware of what's going on here, and you can feel it coming on. So even if it's like, well, it says this, but it's gonna be down, or whatever it goes.